Hi and welcome to my channel. So working for the NHS here in the UK is the best thing that you can do for yourself, especially if like me, you're somebody who is really keen on career progression. The reason is that the NHS does support with apprenticeships, studying nursing for free, for example, studying medicine for free. They will pay tuition fees for you to do your master's, for you to do a degree, for you to do a PhD. There's all sorts of career progression in the NHS, as well as other benefits that they offer that no other private organization or even government organization in the UK does offer. So I've done lots of videos explaining all of that. So in today's video, we're going to be focusing on if you want to get to work for the NHS, what are some of the easiest jobs that you can use to get to the NHS? And then once you're within the system, you can then transition to other jobs that you are really interested in. Because look, there are some opportunities that are just there, like I always say, to get you into the room, to get you into the building. Because if you watch my previous videos, you know there are certain pathways that if you want to do, it is difficult to just go straight in. Everybody's not going to be the same. So these are three jobs that can get you into the NHS. And then once you're within, you can then explore other opportunities that are available to you. So if you're new to my channel, obviously you're welcome. If you're a returning subscriber, I absolutely appreciate your time. And look, I need commitment from you. I'm not doing these videos for the sake of it. So leave a comment in the comment section and say, Melvis, I will implement this, because I need accountability. You know what I mean? I need you to be accountable. I need you to give me your word that you're going to carry on. You're going to follow through with all of this. So leave a comment and say, Melvis, I will implement. But if you haven't subscribed to my channel, you do want to hit that subscribe button so you're the first person to be notified every single day when I drop a new video on this channel. And I also have a free newsletter where I send information directly to your inbox about the best free visa sponsorship opportunities to move to the UK or to switch if you're already in the UK. Also, career progression opportunities. Look, as somebody who I started my journey in the UK working as a carer in a nursing home, I then transitioned to the NHS, studied nursing as an international student, and I now work as an advanced nurse practitioner, which is the most senior clinical nursing position for the NHS. Career progression is something that I absolutely love because I have benefited firsthand from the advantages that career progression brings in the UK. You work less, you earn a lot of money, you're interacting with people that you're gaining a lot of knowledge from. Look, it is a different sort of game. So also work from home jobs that you're going to be paid a lot of money, as well as starting your own side business so you can retire early. Look, I'm on a mission to retire before I'm 40 years old, so that if I'm working beyond 40, it should be a choice, not because I'm broke, not because I have to work. So if you're keen on any of these things that I've mentioned, you know what I mean, you want to check the comment section below and join my free newsletter so that when that information becomes available, any updates about any of the topics I've mentioned, I send directly to your beautiful inbox so you don't miss out. So let's get started with the first job. The first job is working as a porter. Look, when you work as a porter, all you're doing is transporting patients from A to B. And this is a unisex job, which means it's not for men, it's not for women, it's for anybody. In fact, I don't know any job in the NHS is just for men or just for women. And the reason for this is I was supporting one of the members in my private coaching program just yesterday to apply for one of these jobs, and we're going through different jobs on the NHS jobs website, supporting her to apply. And we saw, a porter job, and she was like, Melvis, is it, it's just for men, isn't it? I was like, no, it's for men and women. So if you're a porter, like I've said, all you're doing is transporting patients from A to B. Let's say, for example, a patient is going to theatre for surgery. A porter would go to the ward and take the patient down to theatre. When the patient finishes their surgery, a porter will take them back to the ward. So that's what you do. And let me tell you the fascinating thing about the NHS. The NHS pays according to band, which means that if you're band 2, whether you're a carer, you're a healthcare assistant, you're a porter, whatever you're doing, you're earning the same amount of money. Which means that if you are a healthcare assistant for the NHS, you're going to be earning the same amount of money as a porter. But let me tell you, the levels of responsibility with those two jobs, you cannot even compare them. Because as a healthcare assistant, you are completely responsible for the entire patient, because obviously it is a clinical job. But being a porter is a non-clinical job. So you need to understand the differences to make sure that you're going for the best opportunities. And that's why I'm here to bring them to you. So that's the first job. And by the way, If you're wondering, I do have a private career coaching program where I support nurses, carers, students, student nurses, prospective student nurses, anybody that wants to move to the UK or already in the UK looking for free UK visa sponsorship opportunities. So you're not spending thousands of pounds, you're not spending millions of money, to get visa sponsorship that you're not even sure that you're going to get a job in the UK. Because let me tell you, what's happening now is that people are paying a lot of money to move to the UK, but when they move to the UK, 99.9% of those people don't have a job. In fact, some even get to the UK and the employer just says to them, I don't want to hear from you, do not ring my phone. It's very frustrating. So my coaching program is going to give you access to all of the resources, all of the guidance. So you're applying for jobs directly with those UK employers that actually do have jobs for you, that when you do switch your visa or apply for that visa, you've got a job to do. I know that people like the attractiveness of somebody telling you that, look, you're going to get a job in 2 weeks, you're going to get a job in 3 weeks. My program does not offer that. But you're going to take the due time that you take, but you're going to be 100% sure that if you're getting a job, it is a legit job and you're going to have that peace of mind. You're not going to be stressed out every day wondering whether you're going to have a job today or tomorrow. And look, it is something that I'm currently dealing with. You know what I mean? So you need to be very careful. Also, if you're a carer, for example, but you were a nurse back home and you're wanting to transition back into nursing, you know what I mean? You want to go back to being the nurse that you truly are, I can support you with that journey through my private coaching program, because the NMC has made several changes and there are different pathways now to work as a nurse in the UK without out of OET, even if you trained overseas. Also, I support with applying for apprenticeships, to study nursing in the UK completely free. There's medicine, there's all sorts of courses you can study in this beautiful country to progress your career without spending thousands of pounds. Again, these are the pathways. If you're somebody who is already a qualified nurse, for example, and you're wanting career progression, you want to become a nurse practitioner like myself, you want to get into management, you want to get a specialist nursing job, you want to become a nurse anesthetist, nurse endoscopist, you know what I mean, diabetes nurse, you'll start there wondering, oh my God, how do I progress? I'm so stuck here. Again, I can support you with all of that through my private coaching program to make sure you've got the personalized, tailored, and individualized guidance that you need in order to excel. Because look, these YouTube videos are very generic. I don't know who you are now watching. You could be in the UK, you could be out of the UK, you could be somebody who's got no interest working, you could be unemployed. I've got no idea. So that tailored advice is what you need to get the best steps that you need in order to move forward. So if you check the about section of this YouTube channel or the description box below, you're going to see a link to join. Once you join, we will get started straight away with giving you that guidance so that you can succeed. Like I've said, if you're looking for visa sponsorship, my program is not going to say to you, look, you need 2 weeks and you're going to get visa sponsorship. No, because we're going to work on optimizing your CV, your interview preparation, everything that is needed so that you are ready for that job. Ultimately, these are legit employers. They're the ones that are going to be deciding on who they are recruiting. But the program is there to optimize you so that you know exactly what's needed and you're not, submitting a CV that is like, who would even recruit anybody with a CV looking like this? So you do want to make sure that, yes, certain things are going to take time, but they are worth it in the end. So I'm looking forward to seeing you in that program, and also check out other videos I've done in this channel to help with this particular subject. And that's why I take time to do these videos. Also, the second job is working as a housekeeper. So working as a housekeeper is like cleaning. Again, the pay is exactly the same as a healthcare assistant, as a carer, and a supporter. But as a housekeeper, obviously, the stress levels, you would agree with me, are much lower. And it's also really easy to get a job as a housekeeper compared to other jobs that you would be applying for. So once you get in through this pathway, you're already part of the system. It makes it a lot easier to transition to other jobs. But again, with any job for the NHS, you need to understand the job description perfectly well. You need to be spot on with the person specification. You need to understand organizational values and cultures. Otherwise, it is really tough to get in. And that's why many people apply and all they get unfortunate emails, because you've got to understand the system. Because with the NHS, it is better you don't have staff than you have a group of incompetent people who've got no idea as per what the values of the organization are, as to what the values of the NHS are, and all those expectations that you have from a member of staff working in such a prestigious organization. So again, if you haven't subscribed to my channel, Look, you don't want to be a stranger on here. I don't know what you're still waiting for. Just hit that subscribe button so you're the first person to be notified when I drop a new video on here every single day. Also, please do share this with your loved ones, colleagues, contacts, so that they can apply and benefit from these opportunities. The NHS does offer visa sponsorship if it is needed and if the candidate is obviously good enough. Because, like I've said, it is better to have no staff than have a group of incompetent people that you are recruiting. And that is how the NHS works. And that's why they're very short staffed, but still, they won't just recruit any kind of person to come and work. If you like this video, I want you to hit that like button. It lets me know that you enjoy content like this, and obviously I should do more. If you've got any questions, please do drop them in the comment section below so that I can join you there and give answers to those questions, give some ideas. If you want any video ideas that you want to know more information about, please do leave that in the comment section and I'll consider doing that as well. So let's move to the third option. The third option is working as a ward clerk. Look, ward clerk is admin. So this is admin work that you're going to be doing. Ward clerks are the people that if a patient comes to a ward, for example, they're going to register the patient's details and say, okay, Melvis was admitted to ward B at 10 o'clock, for example. They make sure that the patient's notes are available. If the patient is going for any imaging or they're being transferred to another hospital, they're responsible for getting the notes sorted. You know what I mean? They also answer phone calls on the ward. If there's any messages for the staff, they will take those messages. So it's really admin based, and look, the job is not very stressful because again, you can realize that these jobs are all non-clinical healthcare jobs. And let me tell you, there are many career progression pathways for these non-clinical healthcare jobs than there are actually for clinical jobs, because you can progress pretty quickly, earning a lot of money. So you need to be very wise, when you're applying for these opportunities so that you are making the most informed choice. And that's why if you're watching my videos, that's why I take time to explain all of this so that you're aware of what these opportunities are. But if you're somebody who is more clinical, because there are people who prefer patient-facing roles, because those roles also have opportunities that they bring in their own right. So again, you need to be wise. Check out other videos I've done on this channel about this particular topic. What do you feel about these opportunities? Look, they are well worth it. I've worked for the NHS for 10 years, and I can tell you it is an opportunity not to be missed. And yes, they do offer visa sponsorship, and you 100% want to apply. So check out this other video that I've done, and it's going to help you to understand better about the NHS. I'll see you in this video.